I'm excited to bring you this free chapter excerpt from my ebook, Secrets Your Dentist Never Told You. The book is currently available exclusively through my friends at Aura Wellness. And here's their website and the direct URL that will take you right to their products page. I'll show you this again later towards the end of this video. I'm Dr. Paul Rubin, and I wrote this book after spending over 45 years in my career as a dentist, focused on holistic or biological dentistry. Chapter 1 of the book gives a more detailed introduction to who I am, but the gist of it is that I have been a pioneer in the field of holistic dentistry, and my experience has shown me that there are many aspects of the dental experience, dental care, preventive dental health, and holistic aspects of dental health that most patients have never heard of. They are valuable gems of information that can help you save your teeth, your health, and save you a lot of money. They are only so-called secrets because your dentist has never shared this information with you, for a variety of reasons covered in Chapter 1 in my book. Here's a view of the table of contents of the book, so you can see the scope of what is covered. Not everyone will be drawn to every topic in every chapter, but I assure you, you will find a tremendous amount of valuable and useful information in the book that will make it well worth your while. If I've displayed these contents too fast, just pause at any point. Take your time reading them. For your free chapter from my book, I've chosen Chapter 4, What is Biological Dentistry? Many topics in the book, often ideas or concepts or gems of information that have never been told to you by your dentist, are more typically the realm of holistic or biological dentistry. So it's fitting to first get an understanding of what that term means. I've decided to not just display each page and flip through them, but to present this chapter in a more audio-visual form. So here comes Chapter 4 of Secrets Your Dentist Never Told You. You will see this term biological dentistry used often in this book. Let's get a better understanding of what that term means. If I'm traveling on an airplane, often the stranger in the next seat will ask, "So what do you do?" If I'm not in the mood for talking, I'll say, "I'm a dentist." That's usually a conversation stopper. If I say, "I'm a holistic dentist," that usually sparks a little interest, and they want to know what that means. Holistic is a term people are a little more familiar with. If I say I'm a biological dentist, then generally they have no clue. It's not a term that's in common use yet, except maybe among biological dentists. So when I use this term, you can substitute holistic for biological, and we're pretty much talking about the same thing. Most dentists who have been doing holistic style dentistry are moving towards using the term biological dentistry, so I want to explain that term more fully. The biological dentist has the same dental school training and earns the same degree as any other dentist. But somewhere along the line, they're drawn to a more holistic approach to dental care and general health care, and they find a way to pursue more specialized training and education in all aspects related to this field. It is not an ADA, American Dental Association, recognized specialty, and the term may mean slightly different things to different dentists who choose to use this label. According to the International Academy of Oral Medicine and Toxicology, or IAOMT, and you will learn more about this academy in different parts of this book, in using the term biological dentistry, we are not attempting to stake out a new specialty for dentistry, but rather to describe a philosophy that can apply to all facets of dental practice and to healthcare in general. Always seek the safest, least toxic way to accomplish the mission of treatment, all the goals of modern dentistry, and to do it while treading as lightly as possible on the patient's biological terrain. A more biocompatible approach to oral health is the hallmark of biological dentistry. That seems innocent and reasonable enough, but many traditional dentists look down on biological dentistry as a fringe movement, off the wall, and somehow a threat to the practice of dentistry. Let's take a closer look at what biological dentistry encompasses and stands for, and where it differs from traditional dental practice. A bit of history. The biological dentistry movement began during the late 1970s and early 1980s as a natural consequence of the beginnings of mercury-free dentistry. At that time, a small number of dentists began to turn away from the common and accepted practice of using silver fillings as a mainstay of dental practice. They contend that silver amalgam fillings, which are actually about 50% mercury, are toxic and hazardous to health and should no longer be used in the practice of dentistry. Please see Chapter 6 on mercury fillings for a more complete understanding of the mercury issue. The bulk of dentists in the United States and the American Dental Association did not agree. They contended that silver mercury dental fillings were safe and appropriate, and they continued to hold on to that position even as scientific research piled up to refute it. In 1984, a handful of mercury-free dentists came together to form the International Academy of Oral Medicine and Toxicology. It began as a small group of North American dentists dedicated to educating the profession and the public on the available scientific evidence surrounding the use of mercury in dentistry, and to encourage and sponsor further research. For more about the IAOMT, visit their website at the link below. This is a professional organization, but it has a wealth of information for patients as well. Those and other like-minded dentists began to realize that it was not enough to just be against the use of mercury fillings. To best serve their patients, they discovered it could be enormously helpful to many patients' health to reduce their body load of mercury and prevent further mercury exposure by removing, when appropriate, their amalgam fillings and replacing them with more biologically compatible and non-toxic dental materials. To do this properly, they had to go through their own learning process, first to learn about mercury toxicity and how it affected the body. That led to learning how to effectively and safely detoxify or clear mercury from the system, not just from the teeth. Although many felt this was best left to physicians, it was recognized that most physicians weren't very experienced at dealing with chronic low-level exposures to mercury or even where to begin. Often, this led these dentists to pursuing their own study and research in order to help their medical or naturopathic colleagues deal with this problem. The phrase mercury-free began to slowly catch on with a few more dentists, some of whom chose to use the term as a marketing niche. The more dedicated ones realized that mercury-free wasn't enough. Stopping the use of mercury fillings was a great step, but removing old mercury fillings had to be done with very careful protective protocols in order to prevent an increased mercury exposure in the process of the dental procedures. This led to the term mercury safe. In forging new paths, these dentists realized there were many more windows that needed to be explored in order to maximize their ability to improve their patients' overall health and well-being. They thoroughly researched the biocompatibility of all dental materials, well beyond what they were taught in their dental school training. It was clear that mercury was not the only potentially hazardous material in the dental office. How can they help their patients and not cause them harm in ways that were never dreamed of in their previous professional education? These dentists weren't trying to become physicians, but it became more and more clear how the health of the teeth and mouth were intimately connected with the health of the whole body. If dentists were using procedures and materials that were negatively affecting the body, then they were responsible for those effects. They were also responsible for researching and maximizing their efforts to use their knowledge gained to help improve the overall health of the body. They were discovering ways that were new and innovative, and in some cases controversial. This became the approach that is now generally called biological dentistry. Other names such as holistic dentistry and integrative dentistry have also been used. Just to give some idea of the scope of knowledge that the biological dentist needs to learn about and seek additional training in, here's a list by no means complete. A good biological dentist will have a working familiarity with, and in some cases, quite a bit of expertise in, the following topics: TMJ, or temporomandibular joint disorders, homeopathy, craniosacral therapy, traditional Chinese medicine, or TCM, Lyme disease, cavitations or jawbone cavitations, fluoride toxicity, chelation therapy, neural therapy, ozone therapy, MTHFR genetic variant, biocompatibility testing, ART, MRT, or other energetic testing, multiple chemical sensitivities, oral galvanism, hidden oral infections, meridian tooth chart, or tooth meridian connections. Some traditional dentists have some knowledge of some of these topics, but let's look at the following scenario. A new patient comes into a dental office and tells the dentist, "I'm currently under treatment with my naturopathic physician for Lyme disease. I also have the MTHFR gene, and she wants me to schedule my dental appointment such that I can go to her office immediately after for IV therapy. And she wants you to check carefully for cavitations." The typical traditional dentist would look at this patient as if they had two heads. They might bluff their way through treating this patient, but they really won't understand much of what the patient is talking about. A good biological dentist, on the other hand, would say, "Sure, I understand completely. Tell me more about all of that, and let's get started with your comprehensive exam, and I'll be sure to communicate directly with your naturopathic physician with your permission." Should you be working with a biological dentist? If the information above resonates with you and you want to have your dental care as holistically oriented as your general health care, the biological dentist may be right for you. How do I find a biological dentist? Although the biological dentistry movement is growing, their numbers are still relatively small. It may be challenging to find one close to you. You will have to decide for yourself if it is worth traveling a little extra to work with one. Here are a few ways to get started. There are some organizations of biological dentists that have referral lists of member dentists, and they include IAOMT. I recommend seeking a member who has at least an accredited status with this academy. IABDM, International Academy of Biological Dentistry and Medicine. Dental Wellness Institute. If you are working with or know of a naturopathic physician or integrative physician in your area, they're likely to know of any local biological dentists. Regardless of your source that leads you to one or more names, I do recommend doing your own research. Check out their websites and see if what is presented feels comfortable to you, and if they have any professional affiliations with any of the groups mentioned above. In addition, I feel that it is completely appropriate to call the office and ask some questions. Among the questions I recommend: is the dentist a member of the IAOMT or IABDM or other similar academy? Not all dentists are joiners, so this shouldn't necessarily be a deal breaker. Has the dentist been trained in and committed to safe protocols for removal of mercury fillings? Is the dentist certified by the IAOMT in safe removal protocols? More on that will be in chapters 5, 6, and 7. Does the dentist work integratively with naturopathic or other physicians? If you already have a dentist that you really like and don't want to change, but you'd like to be treated more holistically, perhaps you could inspire your dentist to learn more about biological dentistry. Be advised that, in my opinion, and based on my experience, most traditional dentists are quite resistant and close-minded about this. But every biological dentist had to start somewhere, right? So maybe you can be the one that sparks the interest in an open-minded dentist. The organizations mentioned above are a good source of training and professional continuing education for dentists wishing to learn. Well, that was chapter 4 of Secrets Your Dentist Never Told You. Here again is the link to Oral Wellness for ordering the entire ebook. Please hit like and also subscribe to my YouTube channel. Thanks for watching.